Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Parents of students in private schools protest payment of 25,000 naira for COVID-19 tests as state government seeks understanding. After over 4 months of schools closure following the COVID-19 pandemic, schools in Lagos State reopened today with hand washing, physical distancing and face mask measures in place. And media investigations reveal that number of deaths from COVID-19 in Iran is nearly triple what Iran's government claims. Global figures of recoveries of the coronavirus now stands at over 10 million, while confirmed cases are at over 18 million people who have contracted the virus around the world. In Africa, 601,823 have been discharged across the continent, while almost 20,000 deaths have been recorded. Cases in Nigeria has seen a drop, with the daily coronavirus cases, which used to be around 600, perhaps even higher in a day. But in the last 3 days, the Nigeria Center for Disease Control, NCDC, reported 481 cases July 30, 462 on the 31st, and 386 on the 1st of August, while just last night, the center confirmed 304 new cases in 14 states and the Federal Capital Territory. One of the first time we saw cases that low was around the 10th of April, where the center recorded 305 confirmed cases of COVID-19, and that particular day, 58 people were discharged and 7 deaths were recorded. But in the meantime, of the 304 cases, Lagos recorded the highest number with 81 infections, followed by the FCT 39, Abia 31, 24 in Kaduna, 23 in Rivers, 16 in Plateau. Cross River recorded 13 cases, Ebonyi and Ondo 12 cases each, Ekiti and Edo 11 each, Benue and Nasarawa 10 each, and 6 in Ogun, while 5 were recorded in Gombe State. This brings the total confirmed COVID-19 cases in the country to 43,841, out of which 20,308 patients have been discharged, with 888 fatalities, leaving 22,646 active cases in the country. And after over 4 months of schools closure following the coronavirus pandemic, schools in Lagos State have reopened today, with only students in their final years allowed to return. Lagos State is the commercial center of Nigeria with some 20 million people and has more than 15,000 confirmed cases and 192 deaths, by far the largest share of Nigeria's total coronavirus cases. The governor of Lagos State had announced the reopening of schools for the exit students on Saturday as part of the further easing of the restrictions to curb the spread of COVID-19. In the next 2 weeks, the students are expected to prepare for the West African School Examination Certificate examination, which commences on the 17th of August. Last week, the Federal Ministry of Environment, in collaboration with the Ministry of Education, embarked on decontamination of all Unity's colleges and examination centers across the country ahead of the resumption date.
What did I say? I said whether your teachers are there or not, obey all rules.
That is one of the schools in Lagos today. Our correspondent reports that the Vetland Senior Grammar School Agege, hand basins, running water, sanitizers, digital thermometer for temperature checks, they've all been put in place in order to keep the students safe from the virus. Social distancing is also observed by these students in the classrooms, and all the students have their face masks on. These safety measures are in line with the guidelines on school resumption for transitional students, in this case, who have been allowed to write their WAEC examination. The Permanent Secretary of the Ministry of Education, Mrs. Abosede Adelaja, also says that an emergency room has been set aside for students or teachers who may have symptoms of COVID-19, and the teachers have also been trained on how to handle such cases.
Not what we desire. Do you understand? So please don't take the opportunity.
Now, the Cross River State government has continued its campaign of active case search of COVID-19 cases to border communities occasioned by the increased rate of positive cases in the state. The Commissioner for Health, Dr. Betta Edu, was at the Obudu border axis between Nigeria and Cameroon to create more awareness on the importance of adhering to the precautionary measures on COVID-19. She encouraged communities to imbibe the culture of regular hand washing under running water, the use of alcohol-based hand sanitizers as government sets to distribute sanitizers to them. The team also distributed face masks to the people and their samples collected, taken to the lab for testing.
We are carrying out active case search and surveillance at these communities, and we're also sensitizing them and making available the face masks for them to use to protect themselves. So we tell them the reason why they should use face masks in public to protect themselves and those around them, and also we support them with those face masks. So we've been able to distribute close to 500 face masks, and we will continue to go from one border community to the other to continue sensitization and, of course, active case search surveillance in these communities. We've taken samples from some of them, and we'll be sending the samples to the lab for immediate testing, and results will be sent back to them. But basically, what we're out here doing on the field is to ensure that people know more about coronavirus and that they can stay safe even at this time where coronavirus is ravaging the whole world.
For more on flattening the COVID-19 curve, Dr. Amina Ahmed is a public health physician and medical officer of health. She joins us here in Lagos. Thank you for joining us on the program.
Thank you for having me.
All right, first I want to ask, do you think we're seeing perhaps a reduction in terms of the infection count, looking at the last couple of days in Nigeria?
Yeah, from the results we've been seeing from NCDC, yes, we seem to be going down where the curve is being flattened somewhat. So we're having less number of cases than we had about a month ago or two ago. So I think it's coming down. If perhaps we're doing enough tests, as it were, we're carrying out enough tests. So I think the figures are coming down.
But our testing isn't even up to 300,000. I think we're around 280-something thousand. So with that in mind, with what we knew last week and with some of the data that some of the state governments have talked about, do you think there's even proper surveillance at the state level that's taking place, contact tracing as well?
No, it's possible that there's some laxity in that in some states, but I know that the strategies, of course, for control involves enhanced surveillance, contact tracing, testing, identifying these cases as soon as possible, and isolating them either at home or in the hospitals, as it were, so that they can be cured, they can be managed for COVID-19. But we can't say for sure because the testing in Nigeria isn't at par with what is supposed to be per million as it's supposed to be in Nigeria yet.
So what's your take? There's been talk about a second wave or a second peak. Some have even said that maybe COVID-19 will be like the influenza. It spreads and then it disappears, perhaps ends up in some hemisphere of some sort.
Well, it's novel. There's been new things keep coming up, symptoms one today, another one comes up tomorrow. So it's from what the scientists have seen, yes, there's a possibility of a second wave. In fact, there have been second waves in some countries. They've gone down, come out, released people, and they've come out of lockdown, and then there's another wave hits them. So there's a possibility that it's going to be a second wave, perhaps another wave, or it keeps coming and going. So, and that's the more reason why I think the scientists are looking at it that, okay, instead of just sitting back and waiting for it to go away, perhaps we should look at how the strategies we're going to use to perhaps stay with it and prevent these infections in people and move on with life.
Let's look at Lagos. Schools are, reopening today for exiting students, and you just saw that report. I think the Vetland Grammar School. Are you impressed by that? Do you have any concerns?
Surely, I have concerns. I would have expected that schools would wait perhaps until we see that the numbers are really like, this is just about a week of numbers going down. So we haven't had enough of it per se. And this was during the week of break period. So perhaps logistics may have made the numbers to go down and all of that. But when you look at it again, some other sorts of, West African countries are going on with the exams. So Nigeria is probably looking at it itself as going backwards and leaving the children at home. So they don't want them to lose the year, and they're thinking that, okay, they should go back and join schools in time for exams that will be coming up, I think, on the 17th or so. So I think that's the more reason why the schools are returning. Perhaps, again, the state is perhaps ready for the students that are coming back with the preventive measures, hand sanitizers, wash hand basins, or Victoria buckets, as it were. Perhaps the social and physical distancing in classrooms, as we saw in the clip that you showed earlier on. So I think that's what the state government is looking at, as if these preventive measures are put in place, and then, of course, the students can come back and write their exams, so that study for some time before the exams come up. And I want to believe also that these measures would also be put in place in the halls that they're going to use for the exams also, so that the students will be there with their face masks, maintaining physical distancing, although it's very difficult with students. With children in school, it's difficult to tell them all of these things, but we have to start to imbibe this in them, because eventually schools will reopen, whether this year or not. And
finally, we understand that there is an emergency room supposed to be set aside in case anyone has symptoms of COVID-19, and then that the teachers have been told what to do. Should it be the teachers, or do we need to have a medical person attend, in case there's an emergency in all the schools?
Of course, yes. In all schools, there's usually a sick bay or so for students to be carried to when they're ill. So I suppose they just wanted to, invigorate or to make sure that the sick bays are functional. So once the students are found to be having symptoms, or teachers perhaps, they'll be taken there before they will be taken away from there to contact the NCDC personnel that would come and pick them up for further testing and management.
All right. Well, I'd like to thank you so much, Dr. Amina Ahmed, Public Health Physician, Medical Officer of Health. Thank you for joining us on the program.
Thank you so much. Thank you.
Let's go over to Bayelsa State, where we have this update from our correspondent, Dobra Timiwood.
The Bayelsa State government is yet to announce an official date for the resumption of schools for students participating in the WAEC exams. I'm at the Central APA Secondary School in the Yenagoa Metropolis, and as you can see, it's been overtaken by weeds. Earlier on, I spoke with the chairman of the NUT Bayelsa State chapter regarding what it would take for teachers to go back into the classroom, and here's what he said.
Our need is that the schools should be fumigated, disinfected. Then the teachers and the students will get there and prepare for their studies.
There are 39 active cases for the coronavirus in Bayelsa State as at this morning. Now, out of the 339 confirmed cases for COVID-19, 279 have already been discharged, and the state has experienced 21 deaths. From Yenagoa, Dobra Timiwood for COVID-19 updates.
We have more updates when we return. Please stay with us. Let's take you to Oyo State, where the government has appealed to owners of private schools and parents to show understanding in the face of the 25,000 naira payable by SS3 students of private schools for the COVID-19 test and malaria test before the reopening of schools. The special advisor to the governor on basic and secondary education made the appeal after a meeting with returning secondary schools teachers in Abeokuta, the state capital, while asking stakeholders not to lose focus on the resumption resumption of SS3 students back to school. She, however, said that the test could be done at any Nigeria Center for Diseases Control accredited centers. These tests have been made compulsory for the students as part of measures aimed at reducing the spread of the virus to ensure safety of the students by the state government.
There was misconception, no doubt about that. But government has clarified that, because in as much as we want children to do COVID-19 tests, don't forget that they're coming to a communal area where they're going to be sitting or be sleeping with children for more than 12 hours. You may not be able to contact coronavirus if you're not actually within a communal area. And that's why the boarding house children, we have to be sensitive a bit about it, to mean that they get tested. Because if they get tested, we're sure that they cannot actually infect the other children.
Joining us from the U.S. is Dr. Gertie Chemeka-Ayanwoke, an infectious diseases specialist. She joins us via Skype. Thank you for joining us on the program.
Thank you for having me. Good afternoon.
All right, Gertie, now the month of July saw nearly 2 million people in the U.S. contract COVID-19, and it is reported that about 180,000 Americans may be dead by the end of the summer. This is worrying statistics. Why is the U.S. experiencing this surge?
Thank you for that question. The truth of the matter is that there hasn't been like a national strategy in the U.S. To properly prepare for COVID-19 and deal with it the way it's supposed to be dealt with by a country. And so some of this, I think, may be political, but that's really the crux of the matter, that there is no seemingly national strategy to deal with COVID-19 in the U.S.
In terms of the numbers and perhaps the behavior of young people, seeing as this is a bit about the summer period, do you think that the wearing of masks and the other non-pharmaceutical measures are also being adhered to?
Well, we all have seen videos and reports of young people being out there during the July 4th weekend and other periods, not necessarily social distancing or obeying the mask rule. Somehow young people seem to think they are invisible. And I think that has actually ignited a lot of the newer cases that we have seen all over America.
Is there a difference between COVID-19 and the seasonal flu?
Yes, of course there is a difference. The seasonal flu, like you said, is seasonal, and it's a virus, but it is the flu virus. The flu virus has been around for so much more longer. We every year give vaccination. Sometimes it's hit and miss, but we know how to at least manage it a little better. And yes, every year we lose thousands of patients secondary to the flu, mainly people with comorbidities. When I say comorbidities, I mean like they have other underlying medical disorders, and also the elderly. But COVID-19 is a novel virus. We are not that conversant with it. In fact, it's ever-changing in its manifestations and management. So we will need to have a better understanding, a better management, hopefully have vaccines, hopefully prophylaxis, prevention, and even treatment strategies to be able to be confident in managing COVID-19 the way we are doing with the influenza virus. Also, influenza virus, I think, in my personal opinion, just the way that COVID-19 is transmitted, it seems to be much more widely than the influenza virus. Now, remember that the influenza virus is usually droplets precautions. COVID-19 is seemingly airborne to some extent. So that's a big difference. So when you say airborne, it means just somebody walking into your space within maybe 1 meter, they can get the virus in the air and it can infect them, even without coming in contact with you directly. That's one of the reasons why we ask people to wear masks. So yes, man, there is a big difference between COVID-19 and influenza virus.
All right. We'd like to thank you so much, Dr. Getty Chemeka-Nyawoke, infectious disease specialist, joining us from Baton Rouge, Louisiana, in the U.S. Thank you for joining us on the program.
Thank you for having me.
And now we'll take you to a report coming in from around the world. And it seems that the number of deaths from COVID-19 in Iran is nearly triple what the government claims. That's according to a BBC Persian service investigation. Iran's own records appear to show almost 42,000 people died with COVID-19 symptoms up to July 20th versus 14,405 reported by its health ministry. Here's more details on our Global Update report.
The investigation has found that the number of coronavirus deaths in Iran is 3 times what the government is claiming. The government's own records appear to show almost 42,000 people died from COVID-19 symptoms up to July 20th versus the 14,405 reported by its health ministry. Similarly, the number of infections is double official figures, 451,024 as opposed to 278,827. Australia's second biggest city, Melbourne, which is already under night curfew, has announced fresh restrictions on industries as it steps up desperate efforts to contain the spread of a resurgent coronavirus. From Wednesday night, Melbourne will close retail, some manufacturing and administrative businesses as part of a 6-week lockdown, which is expected to hit 250,000 jobs, roughly the number already impacted.
There is no alternative but to follow the rules. There is no alternative but to get tested if you have even the mildest of symptoms. There is no alternative but to stay at home if you are waiting for a test result or if you have the virus and have been told to stay at home. That's absolutely critical.
Bars, cafes and other nightlife venues in Greece have been banned from serving standing customers after a spike in COVID-19 infections led to the government to stiffen efforts to contain the spread. Greece reported 110 new confirmed cases on Saturday, its highest tally in about 2 months, with 75 more cases announced on Sunday. And Muslim pilgrims in Mecca took part in the final tawaf on Hajj on Sunday by walking 7 laps around the Kaaba, a stone structure that is the most sacred in Islam and the direction which Muslims face to pray. A time-lapse posted on social media on Sunday showed the pilgrims following social distancing measures as they participated in the annual ritual.
Our website has more updates. All you need to do is log on channelstv.com. You find the latest on the pandemic, access to news in health, of course, several other stories. You can see that top story, 3 government ministers in Gambia testing positive for the virus. Don't forget to take responsibility. That's the program. Thank you for watching. I'm Millicent Walker. Stay safe.